I'm Dr. N.K. Venkatramana, neurosurgeon, Brains Super Speciality Hospital. Brains Super Speciality Hospital has an exclusive center for stroke and brain hemorrhage. We call it a center for brain attack. It has got all the gadgets for the diagnosis, investigation, intervention, treatment and rehabilitation. Brain hemorrhage is a very serious condition. Nevertheless, one comes in time and get the diagnosis early and get the treatment early, the recovery can be pretty good. Now, brain hemorrhage, the most common cause is the hypertension. If the blood pressure is uncontrolled, then there can be a bleeding into the brain because of the rupture of the blood vessel whenever the blood pressure goes up. A lot of people have the belief that once we start medicine for BP, it has to be taken for a long time, lifetime. So they either avoid or postpone the BP treatment. Some people take whenever it is required. So this is all wrong practices. It is necessary to take the BP tablets regularly so that the blood pressure is kept under control. When the blood pressure is under control, the strain on the blood vessels is not there. Similarly, the strain on the blood vessels in the brain is not there, and the strain on the heart is also less. So all the blood flow can become smoothly without any strain. Now, whenever the medication is irregular or when the tablets are missed out or they are not taking tablet in spite of high blood pressure, there is a risk that any time a blood vessel can bleed. It can happen anywhere in the body, but it is dangerous, life-threatening as well as disabling when it happens in the brain. So it is mandatory that you take the medications regularly, reduce the salt, do the exercises, do pranayama, keep your weight under control, avoid all the risk factors such as alcohol, smoking, unnecessary medications, drugs, intoxications. And a good lifestyle can keep the blood pressures in good shape. And whenever there is sudden severe headache, it is mandatory that you report to the nearest neuro center so that we can diagnose the brain hemorrhage at the earliest by doing a CT scan. And if there is bleeding, and it has to be controlled immediately by controlling the blood pressure. If the clot size is big, then it has to be operated. And whenever there is a bleeding into the brain, the blood products are very toxic to the brain. It can cause brain swelling, it can cause convulsions, it can cause paralysis, and it can stop the functioning of the brain temporarily or permanently. So it is essential that we treat this condition with utmost emergency. There is another corollary to the brain hemorrhage called subarachnoid hemorrhage, where the bleeding happens around the brain, not inside the brain. This happens because of an abnormality within the blood vessel, and there will be a slight enlargement of the blood vessel like a balloon called aneurysm. This aneurysm keeps enlarging with the increasing blood flow, and with the high BP, it can rupture at any time. Even a simple cough, sometimes a small fight between the people or within the home, or somebody getting severe anger due to some situation can make this aneurysm rupture. Or many a times it happens in the washrooms when they strain to pass the motion and they become unconscious. Now, when the aneurysm ruptures, there is a bleeding all around the brain, making them unconscious. It is typically characterized by sudden severe headache, which they wouldn't have experienced any time before. That is why it's called thunderbolt headache. Whenever there is such severe headache with neck pain and with or without unconsciousness, it has to be treated as early as possible. They need to be taken to the hospital, sedated, control the blood pressure. We do an angiogram to identify where is the leak, and then it can be sealed either by surgery or by simple technique, minimally invasive technique called coiling of the aneurysm.